Hi, Mr. Posner. This is Josium. I'm making a quick video for you to show you how PhantomALERT works.
A deadly new cluster. We're learning that one person has died and 10 others hospitalized after 66 patients at a nursing home test positive for coronavirus. Sarah Westwood joining me now with more on this. So what can you tell us about this nursing facility in Maryland? What measures are now being taken?
Well, Fred, Maryland officials say that right now residents who have tested positive are not being relocated from the Pleasant View nursing home unless they were required.
Okay, as you can see there, sir,
the
on the news, they're talking about a nursing home in Maryland that has reported of patients testing positive for COVID-19. So to report that location is very easy. I simply Googled Pleasant View Nursing Home. That's the address. I took that address and I put it into the alert map right here, and then I go for it, I search, and then it finds it for me right here. That's the Pleasant View Nursing Home, from the news, from the internet. And so to report a coronavirus alert is very simple. You just say add virus and put it right over the location. If you want, you can zoom in, and then you answer a few questions. Did the people have fever? I mean, if somebody was living there, and if I had a mother or father who was at this nursing home, or if I'm an employee or a doctor, you know, if I want to let the public know, if I wanted to let the officials know, you know, we could have found out about this cluster a long time ago by if somebody had used this tool, PhantomALERT. So, do you have a fever? First question. You drag the icon, you put it over there. Second question. Do you have a fever? Yes. Then you can gauge, you can put in the temperature right here. Okay, now, so if somebody puts in a report of saying, yeah, I have a fever at 89, the system will kick out that submission because you cannot have a fever if your temperature is 88. So the algorithm will make sure that whatever data you're giving us is consistent with COVID-19 symptoms. Are you coughing? Yes. And how many days have you had your fever? Are you coughing? Yes. Are you coughing? How many days have you been coughing? 5 days, 9 days. How often do you cough? Do you have a shortness of breath? I'm sorry. Do you have? How often do you cough? Sometimes, often, very often. And then, do you have shortness of breath? And if you say yes to this, we'll submit the. Once I hit save, we'll submit the point of interest, alerting the system that somebody had reported a coronavirus with these symptoms to that location. Once you save it, we also have a pop-up message that can come out here. This could be customized by for anything. I mean, we can send you directly to a CDC. To if it's, for example, if this was used by DC government, you would have a DC government message. If this was done by the CD, you would have a CDC message. If this was done by the Ethiopian government, you could have a lot of messages saying, "We heard you, we got the information, we are your government or an authorized agency, and we'll get back to you shortly." So this would be a very nice way of communicating with the public. Now, here again, the way you form a cluster, you identify a cluster is, let's say 2 weeks ago, somebody also reported that they had fever, for 9 days, cough for 10 days, and they've had shortness of breath. Now, as soon as you save this, now you're seeing that within the past 9 days, these people are saying, I started getting sick 9 days ago. So if you start seeing more people saying that they're sick, this is exactly what you need to do. Get people to be tested and go find these people, take care of them, and make sure they're not spreading the illness. So this is exactly how PhantomALERT would work. And the one thing I want to show you is, you can see here, a day ago, somebody had reported, 3 days ago, we had somebody report Jessup Blair Drive, Silver Spring, Maryland. Virus alert again in Maryland. New Jersey. So all of these locations, they're showing a cluster. Now, you can see the addresses here, but if you go to the real map on our apps, you don't see any of those points of interest viewable to the public. They first go to the agency or authority like the CDC, hopefully, or some kind of health department. Then once they allow these submissions, if they're verified, for example, right now these are my submissions for the 3 that I reported for the nursing home. Here, this is how they're going to show up. So if you start seeing the same address showing up back to back to back, that's when you know that a cluster is forming. So this is how PhantomALERT would work, and letting the authorities know where all the symptomatic people are, and then of course also by showing where the nearest hot zones are, they're gonna require people to behave accordingly. Like social distancing will be more complied with if you knew what was next to you. That is a very powerful message. If you know that there is a danger on the road, for example, like the way we used to do it with the speed traps, if you know that there's a cop waiting for you ahead, what do? You modify your behavior. You slow down and you pay attention. So here, this also could be used as a tool to help drivers, to help the citizen comply with the local requests for social distancing.
At a nursing home, test positive for coronavirus. Sarah Westwood joining me now with more on this. So what can you tell us about this nursing facility in Maryland? What measures are now being taken?
Well, Fred, Maryland officials say that right now residents who have tested positive are not being relocated from the Pleasant View nursing home unless they were requiring a higher level of care. And also the nursing home staff there, they're stocking up on personal protective equipment as they try to help the residents who still remain in the nursing home. Now 11 people have been hospitalized because they have more severe symptoms. One man, a man who officials say was in his 90s and had many underlying conditions, did pass away overnight. Now, you mentioned the Life Care Center in outside Seattle, Washington. That was really the first big cluster of coronavirus cases that we saw in the U.S. But since then, this outbreak in Maryland appears to be the biggest outbreak within a nursing home.
Mr. Posner, basically the point I'm trying to make is PhantomALERT, if properly used, you can start seeing clusters forming, and we can head off this virus and flatten the curve with the help of crowdsourcing, user-generated content. The only thing PhantomALERT needs is more awareness, more users. If doctors, nurses, first responders started using the application, I think the public would follow, and then we can map out, track, trace, view, and contain coronavirus and stop it. Thank you.